Okay, I think we can start. Dear ladies and gentlemen, dear friends and colleagues, it's really a great pleasure for me to welcome you at this breakout session about research and innovation. I think in these times, a question we as a society should always ask, at least from time to time, especially also in these days of COVID-19, where would be our society, where would be we without health research? I think European biomedical health research, spanning from basic and translational research to clinical research, has really significantly expanded our knowledge of diseases, our knowledge about disease management, and also helped to make numerous health innovations available. For instance, research has led to treatment options for some non-communicable diseases, also development of vaccines against the deadly Ebola virus, and hopefully also we will lead to vaccines against COVID-19. But much remains to be done to ensure that researchers will continue to generate new knowledge about the development of diseases, and that also researchers and clinicians are eventually be able to translate this knowledge and bring the best new treatment options to patients to improve the life of all EU citizens. With many unmet medical needs, with potential emerging new health threats, improving and supporting health research has never been more urgent. That is one of the reasons why partners of the EU Health Coalition, Research and Innovation Policy Group, have worked together on recommendation and calls to action to address important issues. It's great that you all join our discussions. I think we have already more than 80, 90 people attending these discussion sections. It's time for European leadership in health. It's time for action. And today, in this breakout session, we will have three great speakers. I've been already partially introduced to you. I will introduce them later on again. I would like to welcome you then as well to this session. Thanks that you're participating in this important discussion. And just to briefly say, the aim of the session is to go from the proposed recommendation and implementation action to a concrete implementation plan. So, and just as a quick reminder, the three recommendations concerning this panel is to invest in Europe as a true research and innovation hub, to coordinate research efforts across Europe, to be able to try to tackle emerging complex health challenges, and also finally to ensure greater flexibility to support translational research. We invited each panel speaker to select one recommendation and to identify how this can become a reality based on his/her expertise and experience from concrete research projects. There are exciting policy initiatives across Europe that are now taking shape: Horizon Europe, EU for Health program, pharmaceutical strategy, synergies between public-private partnerships and public partnerships, the new European Biomedical Research and Development Agency, and many others. The question, of course, is also how can all these be mechanisms connected and can be taken on board of the proposed recommendations and the call for action, and to ensure that Europe will remain and increase as a research innovation hub. Finally, before I introduce the speakers, I would like to remember the participants that we will also have a question and answer session, and therefore please also use the Slido and the hashtags. And hopefully there will be for sure there will be possibility to ask questions afterwards. Fortunately, probably we cannot accept all the, or we cannot take all the questions for time reasons. But again, therefore we have also the Slido sessions where actually you can put some questions and also can address some of the questions you are asking. With this, I would like to give now the stage to our panelists, and I start with Professor Martin Landry. He's a member of the Regulatory Affairs Committee within the University of the European Society of Cardiology. He's also Professor of Medicine and Epidemiology at the University of Oxford. So with this, I would like to welcome Professor Landry, and we are looking forward to your participation. And afterwards, I will also introduce the other speakers as we move on through the program. So Professor Landry, the stage is yours.
Thank you very much, and it's a great pleasure to be here. So I'm going to sort of tell a story and tell a bit of an experience, and hope that that helps us to formulate some of our discussion. I think perhaps COVID in particular has thrown a new challenge that is transborder. COVID is a disease that can affect anyone, regardless of location, regardless of age, regardless of background. And because of that, COVID has really accentuated both the strengths and the weaknesses of many of our current approaches. Now, personally, my background is all in cardiovascular disease. I had done not a single piece of research in the context of infectious disease until about March the 10th this year. And it struck me then that some of the lessons that had been learnt about how to tackle myocardial infarction in the 1980s were subtly relevant to how do we tackle some of the huge uncertainties that we are looking at for COVID in 2020. And I want to really pick on this example. I think it's the number 6, which is about coordinated research efforts. And there was a line in there that really struck an accord for me. It said that the EU should put in place instruments and mechanisms that encourage collaboration and multidisciplinary approaches and initiatives. Now, it's tempting, of course, to think of that in a purely geographical sense. How do we get people from different parts of Europe all to be able to coordinate, collaborate, and conduct research together? And of course, that's important and it's relevant, and doubtless many will speak about that. But I want to think about that in a rather different way, about a multidisciplinary way. In particular, I want to think about how can the regulation, particularly, for example, the clinical trials regulations from the European Medicines Agencies and the subsidiary bodies, the national entities, how can that play a role not only, if you like, as a policeman to identify what might or might not be good or bad about a particular clinical trial, but how can that be engaged as an enabler? Because I think what we have to do is really completely shift the dynamic with health research, and particularly in the field of clinical trials, to see those not as something that is an optional extra on top of routine care, but is actually fundamental to routine care. This is why COVID has been such a fascinating experience. At the beginning of this year, there was an entirely new disease which not a single doctor in the entire world had ever met before or knew how to treat. And in those circumstances, this disease, which kills 1 in 4 people who go into hospital, we had 2 choices: to throw a bunch of treatments at patients in a sort of hit and hope technique from which we would learn nothing, and there's been a lot of that has happened, or actually to put clinical trials at the heart of clinical care, to bring them to the bedside. And somehow we have separated out historically research over in one group, in one place, from clinical care in another. And COVID has completely emphasized that those 2 disciplines cannot be seen, should not be seen, must not be seen as being different. And so when one thinks about collaboration across Europe, of course, geographical collaboration, but so too collaboration between those responsible for delivery of health, those responsible for designing and delivering clinical trials, and those responsible for regulating them, whether that's regulating in the sense of approving this trial can happen, regulating on the basis of GCP, this trial was up to some standards, and regulating on the sense of results are entirely plausible. And with that in mind, and I'll sort of give a sort of final example, and then we can come back to this in discussion. In the context of COVID, with the recovery trial, which is UK only, as opposed to the solidarity trial, which is more broadly, I think that's just arbitrary, like it doesn't weaken the argument. Then the issue was, how can you make it as easy to randomize a patient in a trial as to just prescribe a treatment? How can we minimize the burden on frontline clinicians and patients who are often elderly, seriously sick, and usually alone because of infection control, and get answers that fundamentally change practice? How do we save lives? That was the question. And by doing that trial in the UK, it's now over 40,000 people, we set up the trial. As I say, my first experience of infectious disease was when I wrote the first protocol on the 9th of March. We put the first patient in on the 19th of March. That was collaboration to make all those approvals happen and deliver that. 8 weeks later, 10,000 patients randomized. Within the first 100 days, 3 major results, each of which went against medical orthodoxy. Hydroxychloroquine for hospitalized patients does not work. Lopinavir for hospitalized patients does not work. They, by the way, were top 1 or 2 recommendations in many countries. And dexamethasone, which most recommendations said should not be used, turns out that it saves lives and reduces all-cause mortality by 1/3 in the sickest patients. How did that come about? That came about because of collaboration and because of the regulators actually seeing the research as part of the solution. And if we just wind on from there, we announced the result for the dexamethasone result at lunchtime on the 16th of June. At tea time on the 16th of June, it was national policy across the UK. You could argue that by that weekend it was saving lives, and very rapidly, with good collaboration from the European Medicines Agency, we were able to take that all the way through so that that is now being recommended not only across Europe but internationally. That's what collaboration looks like, and that's what we have to focus on. And we particularly have to unpick most of the bureaucracy around clinical trials regulation and good clinical practice that is focused on what can we check. Let's see trials as a problem. Unpick that, remove that, and focus back on the science and back and seeing clinical trials as an enabler, as part of the solution. That requires a completely different mindset and different way of working. Thank you very much.
Thank you, Professor Landry, for this very impressive statement, and also showing actually how important it is to collaborate, but not only, as I nicely mentioned, on a geographic basis, but also within Europe, within countries, just on different levels. So I think that's a very important point you made, and probably we will come back in the discussion session about this, maybe to discuss this in more detail. So I would like to move on now to our next speaker, which is Dr. Cristina Vescos from the EIT Health Spain. She's the managing director there. And EIT Health Spain actually aims to foster innovation by supporting health innovators across Europe. And we are looking forward to your presentation, Dr. Vescos. The stage is yours.
Thank you very much, Wilfer. I would like to stress the part of, this panel is about research and innovation, and I will pick up the subject of innovation. What we see in Europe and is that we do good research in general, but we are losing the battle of innovation, and we really need to position Europe in a comparison to China and the US and be able to be in the front runner of innovation. And what I want to stress is these are two different processes and two different aims. And research is about questioning the reality and looking for more knowledge that will bring to new questions. And it's a whole methodology of learning and doing the things systematically, but for the objective of knowledge. Innovation is a different process where you are from this idea or from a solution, you need to develop a service that brings value to a community, to a citizen, to somebody who is willing to pay something. And that means that it's a process that's driven by result, and it's not just the knowledge that is important. And we've seen also in recent publications of WHO that in order to battle COVID and in general to position Europe in the front runner of healthcare, we not only need research, which is important, and I'm not claiming that this is really necessary, but we need really to concretize the efforts on innovation. And that means a different set of stakeholders where we need definitely public-private partnerships, and we need to address business models. And I understand that we are dealing with many public systems, and we are not talking about privatizing healthcare. We are talking about working together for a common goal that is bringing results. And we may not be profit-driven in research, but we are margin-driven because apart from bringing the best health for the European citizens, we know that with the challenges we have of chronicity and aging, we don't have capacity in the current healthcare system, so we need to improve the efficiency of the systems. And third, healthcare is an impressive industry, and it's a way really to get a very good talent for Europe in research and innovation, and also, it's definitely an economic power for Europe. So I'm going to concentrate also on the part of coordination, and what my message is this type of partnerships for collaborating towards innovation. So I'm representing EIT Health. EIT Health is a body of the European Union, so the European Institute of Innovation and Technology, and the health part is really to tackle the societal challenge around healthcare. And EIT Health is an association in the end composed for more than 150 stakeholders all over Europe, all disciplines in healthcare, stakeholders from industry, the private sector, the healthcare providers, the universities, the technology centers. And the important is not only that you create a partnership and a network, is that you work together for this aim. And I want to give you also an example related to COVID, what will happen in the last month. So we need to concentrate the efforts and the resources we have in healthcare innovation. And what happened with the IT, we were able to mobilize 14 million euros around the COVID strategies in 6 weeks. And I'm saying that because we launched in 6 weeks more than 10 innovation projects, international coordination projects for research and innovation. So and those were really to be working through this year. And also we launched a program to rescue startups and SMEs that were having difficulties in surviving this complicated year. And those 2 instruments were really able to be spread all around Europe in 6 weeks. And if I give you an example of one of the projects we launched, it's a COVID crisis response center in order to define the prognosis of the patients coming to hospital and understanding identifying which ones could have the worst prognosis in order to dedicate the most resources to them. And with that approach, at the hospital clinic in Barcelona, they were able to reduce by 50% the number of deaths of COVID in the hospital. And this is a project that is a collaboration between Spain, Belgium and Netherlands, and now it's also applied at Erasmus Center and a hospital in Louvain. So what you can see is in very short time, you can put the resources together, not only for shared knowledge, which is important, but it's also really to take actions and provide a service for the citizens, for the healthcare system, and also for, for the economy of Europe that is essential. So I would emphasize this part of the coordination, and especially in these moments related to agility and speed.
Okay, Christina, thanks a lot. We will have 2 questions after we had the third statement. And thanks again for the nice overview about EIT Health, explaining what you're doing. Perhaps in between, let me just remind you, you can already ask questions via the Slido system, so that we have actually a lot of questions then to our panelists in the overall discussion section. With this, last not least, I would like to move on to Sabrina Montante, who is the Senior Advisor for EU Affairs for the National Institute of Health of Italy. You are a Senior EU Policy Advisor and a Strategic Project Consultant. So we're looking forward to your presentation today and to your thoughts about the Research and Innovation breakout session and the important topics.
Thank you very much. Can you hear me well? Great. Thank you very much. I'm here also on behalf of the To Reach project, which I'm coordinating together with another great team from the National Institute of Health of Italy, and together with other national research bodies from different countries across the EU. So I'm very happy to be here today because I see that our work is very much aligned to what has been said so far. And I think I will bring a different perspective perhaps today. So I have to say that I really joined the recommendation, the 6th recommendation of the View Health Coalition on the need to coordinate research efforts across Europe to be able to jointly tackle emerging complex health challenges. But again, I will bring a different angle today. So I've been working in this project To Reach, which is bringing together several national bodies, as I said, and beyond Europe as well, since 2016, and that is specifically recommending to joint efforts for aligning research innovation agenda and investments, in particular to address the increasing challenges faced by our health and care systems, and especially revealed by the current COVID-19 pandemic. Health systems are translator of the innovation developed in the biomedical and technological research innovation field, and we desperately need to advance current knowledge, tools, methods on health systems and services to make these health systems sustainable and resilient, enabled to observe the innovation mentioned by my colleague before, indeed. So looking at the current pandemic in particular, though to reach started much earlier, we see that the COVID-19 has highlighted the pre-existing challenges, and in particular, looking at the pandemic and to the current response, we see that health systems are introducing radical changes in terms of emergency protocol, public health measures integrated with the organization of hospital care, responding to the pressure placed on critical care, in particular, strengthening primary care, the need for innovative digital solutions, as mentioned by colleagues before, to cope with the shortages of medical and protective equipment and infrastructure, the importance of introducing strategy to really address the shortage of healthcare workforce while ensuring at the same time that we protect the vulnerable population. So these are all major concerns for many European countries, and these were highlighted actually. Also, I'm happy that were highlighted also in the plenary session by Commissioner Kyriakides, indeed. And COVID-19 has just made this very clear. So complex transformation is necessary, but these do take time and need to be guided by strategies and policies that are based on the best evidence. And cooperation among countries is now essential. So we need coordinated research innovation efforts on health services and system research and innovation to avoid duplication of efforts. We need to share important knowledge and improve the implementation and transferability of innovation across Europe, indeed, and allow for necessary knowledge translation to happen. So in terms of action, so to reach really aimed at building the ground for the European Commission, member states, associated countries to financially support and implement a coordinated research innovation initiative, not only by the biomedical field, but also addressing the increasing challenges faced by health and care systems. We need to involve a wide spectrum of stakeholders, reflecting the complexity and diversity of health and care systems across Europe. And health systems are indeed different, and no one size fits all, but sustainability challenges faced by them are largely the same. So by joining forces, we can learn from each other lessons, avoid fragmentation of research, innovation, efforts, and as it happened until now, indeed, because we have been funding this, but we have been funding in a very fragmented way, and we need to identify and implement innovative solutions, both in terms of service and policy and technology, and we need to better communicate to policymakers the research and innovation results and actions, share a common language, and build the research innovation capacity. So to be very, very clear, I think that what we need here is to move towards a joint research innovation program in this field that has been discussed already quite a lot. After 4 years of, that was the aim, the initial aim of to reach, and after 4 years it becomes quite clear, even more clear now with the current pandemic. And indeed, we need to move forward towards a European partnership on healthcare system transformation. We need a co-fund effort from member states, associated countries, and the European Commission to align investments and resources on research innovation to support healthcare system transformation, implementation, and advanced methods and language and knowledge translation. And last but not least, capacity building. And who has to do that? Who else should be involved? Who is responsible for that? Well, transformation of the diverse health and care systems of Europe is an extremely complex endeavor that needs to be addressed from many angles simultaneously. We need to learn to use a large toolbox of instruments. We need to involve policymakers, funders, owners, researchers, innovators, formal and informal carers, and last but not least, I would say citizens. So successful transformation depends on decision makers' ability to learn from each other across national and regional borders, and perhaps across the borders also of different sectors. So to move from evidence to practices, and really to use this know-how to steer the necessary investment and implementation in the direction that matches the vision of health and care systems in the future. So this is pretty much what I think is important. Happy to participate to the Q&A. Thank you very much.
Okay, so thank you very much also for your statement. I think a lot of important words were already mentioned actually by all three panelists. It's about coordination, it's about collaboration, not only across nations, but also across countries, but also across the different levels of stakeholders, of regulators, of administration, of researchers, of health providers. It's about involvement of all stakeholders. And I think we have already several questions now they're coming. And I think I have also kind of an order of the questions on my mobile. So perhaps we start with Bernard Grimm's question because it came in as number one in my mobile app and WhatsApp. So there is a question about how do we make the positive experience of COVID-19 clinical trials as a new standard for clinical trials in general for all patients. So that's something perhaps Martin Landre, you want to address first. And of course, all other panelists, if you have some comments to also the other talks and also about the other questions, please feel free just to answer them. I hope we will have a lively discussion.
Thank you very much. I mean, I think the first thing to recognize is that although I sort of used COVID as a sort of urgent emergency highlight, the reality is, first of all, COVID hasn't cured any other diseases. So the demands, particularly of the chronic diseases of late, middle and old age, have not gone away. And it's those that are both placing huge burden on the population at large, but also on our health systems right the way across Europe and beyond. The second is that the clinical trials approach of the last 20 years is seriously broken, where many trials are costing between €500 million and €1 billion for a single trial. Somebody has to pay for that, and that's the people who are paying for the prescription of the drugs at the end, but also there are huge opportunity costs because different potential treatments just don't get taken forward because companies can't afford that size of a bet. And thirdly, that because of those enormous costs, people try to work out how they can cut corners, how can they reduce the sample size, reduce the duration of follow-up, reduce the types of patients to find the one perfect patient in whom this drug is almost guaranteed to work, making the results much less generalizable. So there's a serious piece of all of us, of self-criticism needed in that. I do think that there is a piece around the European Clinical Trials Regulation and then how that is implemented, and particularly how it's then interpreted, inspected, both from agencies, regulatory agencies in each of our countries, but also actually within our own organizations. So the regulatory departments of big pharma companies or big universities or big hospitals and so on. We have to see clinical trials as part of the solution, that just using treatments in a hopeful way without knowing is actually harmful to patients. As somebody in a meeting I was at last week said, it's not unreasonable to argue that more patients are harmed by the absence of clinical trials than by misconduct of clinical trials. And that is simply not recognized. We should be looking not at how do we make sure people are specially trained in clinical trials, how are people specially trained to take consent, specially trained to take blood. I mean, a phlebotomist takes blood, a pharmacist hands out tablets, and doctors take consent all the time. The question is, what's so special about this particular clinical trial? And that is a serious shift in mindset. That requires a level of sophistication and thinking within all of our organizations that's going to require training and really quite a different framework. One cannot do this on checkboxes alone. And trying to do clinical trials or clinical trial regulation by checkbox is extraordinarily unhelpful, in fact, detrimental to public health. And that's what we've got to tackle. There's one other piece I would point in here. There are opportunities. The relationships between doctors and their patients are very different now to how they were in the 1980s, when there was a very patriarchal, and it was patriarchal, there were very few matriarchs in the 1980s in medicine, I'm afraid. There is a very different collaboration partnership approach. The second is data and technology. We live in a world where communications and data management are so different from how they were even 5 years ago, let alone 20 years ago. And yet clinical trials are costing thousands times more, not thousands of euros, thousands of times more than they were in the 80s and 90s, despite all these advances in technologies. we've got something seriously wrong when we get to that point. And we have to think very carefully about the value that we can get from sharing information and for putting randomization in clinical trials actually at the heart of what we do in order to improve care for individual patients and populations.
Thank you. Sabrina, Christina, you want to add something on that? Or?
Yeah, so following on what Professor Landry had mentioned, I think is this part of integrating the innovation process into the routine what is key for Europe. And you've talked about clinical trials, but I would like also to bring forward the part of real world data. What we see in Europe is we have a wealth of data that we don't use. I mean, first because we have not been able to collect it appropriately, but there has been already some initiatives in order to facilitate the archiving and the knowledge base of it. But what is still a pending challenge is how to use this data to generate new knowledge and new solutions and to make it really fast. There was also a question about how to make that quick. I think it's utilizing the data that we have not only from the clinical practice but from real life into the health management is essential for bringing speed, because that is really what we've seen from COVID is that in 6 months you can have a knowledge base about a whole new disease. So we are able with the current technology to bring this data forward and make sense of it, and that for me is we don't have a clear approved methodology and an explanations for the researchers and innovation, what type of validation is required in order to use this real life data integrated to the clinical practice. We have a very clear standardized process for clinical trial, but we don't have other ways of validating technologies or solutions, and especially talking about digital health, things that are really requiring very fast approaches, and also incorporating the knowledge into the algorithms at the same time as you're validating, and that is essential for the speed.
Okay. Oh, sure, no, of course.
I think that thinking about what has been said by colleagues before, integrating innovation into the routine and how to make an effective use of data, these all require further knowledge and understanding on organizational innovation. I will call it then innovation in the organization of care and system. So in the end, I think that further research innovation that is helping us to understand the contextual factors that really enable for innovation to happen at service and policy level will be necessary to make sure that this is going to happen, that we can absorb this innovation in practice, and we can indeed integrate innovation to the routine. And this requires an approach that looks at the different angles. Capacity indeed, organizational factors, we gain into contextual factors, and then regulatory frameworks. There are many different angles that together can make innovation an organization and make sure that we can implement what we need. Thank you.
Okay. Thank you. So before we move on to the next question, I would just like to remind also the participants that also via Slido we are asking questions where we would like to ask you as participants just to answer with one word. It's about which is the most important implementing action or concrete solution missing, and maybe also describe in one word what you would like this breakout session to achieve in terms of policy action. Thanks a lot. So we move on to the next question. It was asked by Jens Jäger from the Helmholtz Association. How can we keep the momentum now that the EU research budget will be cut? So in terms of momentum of an emerging health crisis, that everyone understands that health research, that health is important. Any one of you has a solution?
I can start trying maybe and can follow, please. For me, what has changed with COVID is the mindset related to technology and acceptance of the culture of innovation. And I think that is a huge opportunity that we should definitely not lose. And yes, we are going to face clearly an economical crisis and a reduction in budgets in general. So for me, the solution to that is really clearly focus, focus, and focus. And that means we need to tackle where we are in Europe, and I think in terms of innovations and bringing things really to service is we are good in generating knowledge. We are good in talent in Europe. We have good healthcare results, so build on that. But what is the main challenge is the part of scaling. We have to understand, in order to bring really service forward, we cannot just have 2 people of a very small company in Madrid, 2 other people of another different company doing the same thing in Berlin, and 2 people of a different company also doing the same in Rome. We need to be able to reach medium enterprises, so the SME will moving towards the M, because that's where really we gain efficiency. So we will have less resources, that's clear, but the way to optimize the resources is to concentrate on the scale process, and that scale process doesn't need to bring just a centralization. It can be, as the example I provided, could be completely spread, and that is also one thing that we've learned of COVID, that we can work together international teams. But we need to make initiatives and projects of a scale that really can bring the innovation forward, and stop doing more and more small pilots, repeating the same thing in 20 different places.
Thank you. Somebody wants to add something?
Well, I joined what... Oh, sorry. No, Will, please go ahead. I can wait.
Okay, then Sabrina first and then Martin, okay?
Okay. Thank you. Well, I think that we are going to have little resources again. So really thinking of how not to waste these resources, and really think there is much waste, I think, still in our health and care systems. And research innovation can bring an important support to that. And once again, transferability, to be able to identify innovation, service and policy innovation in different countries, but not only in the different countries, I would say in different regions. So having actually one initiative, rather than multiple initiatives at European level, but try to really avoid duplication of efforts and make sure that we work together, will allow to have all these stakeholders together and really make sure that they speak to each other, and we avoid this fragmentation and waste of resources. Because in the end, and it's important, I think, that many times, I mean, we can say that, frankly, health and care systems is something that is done by, I mean, under the competence of the member states and associated countries, and it's not in the hands of the European Union to regulate health and care systems. But it is possible for the EU to support further research innovation, to provide answers that can be translated to effective strategies and policies then at national and regional level. And therefore, we need all levels to work together, and we need to build an ecosystem able to really bring together the different actors working on research innovation, but also practice. And I will strengthen the role as healthcare professionals, health workforce, because that's very much a major concern for our health and systems in Europe. And we can build all the innovation we want, but if we are not able to really have professionals able to translate this into practice, then it's not going to happen. Thank you.
Okay.
Yeah, and we just have to, I think, get this balance right between much of innovation starts with one person's or a small group's idea, and much of implementation and impact is when actually there are few barriers to making that small seed grow into something big. And if you look, actually, well, take clinical trials, just because it's a good example. If one looks back, CHMP at the beginning of the epidemic in the I think it was the 13th of March, 16th of March, something of that sort, said, what we need is a few large trials which will require collaboration across multiple hospitals, across multiple countries. What we got was actually that there were hundreds, if not thousands, of tiny little studies, none of which have produced any useful information at all. I mean, one could even argue that they've been worse than that in that they have distracted from people contributing to the bigger picture. At the same time, I think one has to be careful not to impose some sort of monolithic, this is the way it's going to be done, and impose this, a sort of structured system across the top, because that makes it impossible to innovate. And it's quite a good way of wasting an awful lot of resource. But back to my sort of theme on regulation, I think we have to turn regulation, and as we often call it here, red tape, not into something that get tied up in or that is there to trip you over, but into something that helps you find the solution, helps you find the way. And so we really need to be thinking very, very differently around regulation, not only about how clinical trials are done, but information sharing, about data sharing. How can we actually allow things and good stuff to flow and put the responsibilities on actually that trustworthy partnership? And that, again, is about reshaping the relationships between organizations across borders, whether they're national borders or borders between two different companies or between different sectors, and with patients and public too. So I think we have to really be reimagining. We cannot regulate ourselves out of this sort of crisis, and yet that so often is the response. If there's a problem, let's add regulation. Regulation should be there to guide. Regulation should be there to catch and give you something to catch the most extreme bad behaviours, of which there are some, but we should not try to regulate every detail. No one can innovate, no information will flow, and we will waste huge amounts of resource, which clearly with a receding budget we cannot afford to do.
Okay, thank you. So we will have one more question from the Slido, then we move to a question in the chat session, then we go back to the Slido questions. Okay, so there was a question by Magda Krepus, how to bring more agility in European research and development funding programs. Any ideas about that?
Perhaps I can start?
Yeah, sure. Yeah. Please.
I think that in the future Horizon Europe framework program, the Commission has already started a process very important of trying to, bring together different initiatives that in the past used to be separated. So the effort is there already with the partnership, but I think that perhaps further, mechanisms should be put in place while developing the governance of these different initiatives, and make sure that each of them really include clear mechanisms for cooperation with other, concrete cooperation with other initiatives in place. For instance, if we are going to have a partnership on health and care system transformation, then this has to be linked with the future innovative health initiative, because the much of the results of the work done on health and care systems could be used by the work done by the innovative health initiative and vice versa. And this is also for other initiatives. I'm just mentioning one of them. So really concrete mechanisms to make sure that there is an exchange, and not like in the past in which each initiative was running alone and there was not much an understanding of what was happening. And last but not least, involvement of the users, of the citizens. I mean, we need very little understanding from the general public. There is very little understanding on what has been done at European level. So in the end, we don't create a necessary impact. We need to improve that. Thanks.
Thank you. So perhaps, okay, thank you. So we move on to the next question. I just heard we should try to answer the question, or we use the question format via the Slido. So can you please just show us the next question for the technical stuff, please? I think it was a question about BARDA, right? If I remember correctly. Yeah, it was a question by Brian Ward. So the Commissioner Kyriakides mentioned BARDA. So what roles could academic, researchers, medical societies play in such an agency? And also how can we ensure that it does not just cover stockpiles, but also long-term health challenges, plus, of course, unmet medical needs? I think that's a very important question as well, because it's something about sustainability, about long-term vision. And again, it's not COVID, it's also other unmet medical needs, right, which needs our attention. Christina, you want to answer something?
What I can talk about this kind of long-term needs, so having been involved in European research, I think the fourth framework program where I've seen it, I would say two things. One is we have invested a lot in building the consortium, and then you generate a project, solution, whatever, and we have a clear difficulty in translating that into the next phase. And it's a bit what also Sabrina was mentioning. We need to align the instruments so that we don't propagate these valleys of death. So that one instrument can support the next one, and that we understand what are the results, outcomes of one instrument to the others with the proper evaluation and so on. And linking to this is not only the alignment of the public support, but it's also how to align the private one. And what we see is we make a lot of efforts in generating this consortium for projects, but then those connections are lost once the project is gone. And it's very important to have this kind of European innovation partnerships or the IT model, because once you have the network and it's a bit of a stable, you can be much faster in looking for the right expertise and the right contacts for a specific initiatives. And we've seen that in terms of also of the agility of VIT Health, is because the network is there. It's very easy to find, okay, the adequate society, the adequate university, and you know the different profiles, and that's much easier than if you need to build from scratch every time you need to build a new project. So I would say these two things: alignment in the private and public sector, and second, have a baseline of support for the collaboration, stable structures of partnerships and collaboration.
Think about is how does one combine stability with being sufficiently nimble. And I think that, and related to nimble is not only what are the new challenges that are thrown up, but also what are the range of opinions or views or inputs that you might need to avoid some sort of serious groupthink. And if one's not careful, one ends up with structures where each new project or program looks remarkably similar, or is judged through a set of eyes that looks remarkably similar to the last one. And so thinking carefully about how one's able to bring in that diversity, not diversity just in terms of, again, location or ethnicity or gender or whatever, but genuine diversity in the terms of the way that people think. And trying to bring people often who are from outside the particular, the most obvious stakeholder groups that might help you to think differently and better, but without distorting, so that suddenly people come in, everybody who comes in with a sledgehammer thinks that what they can see in front of them is a nut that needs cracking, that one actually is thinking in a constructive way. So you keep on focus, but you at the same time can get that nimbleness, both in terms of how quickly you can set something up, but also in terms of the thought processes and the imagination that's needed. That's quite challenging, but it's important. And again, I'll come back to my regulatory piece because I think it is important. The regulators are part of that nimble solution. The challenges of today are different from the challenges of yesterday or a few years ago, and therefore they need slightly different approaches. And just because the rule book says something doesn't necessarily mean actually the rule book is right. And we shouldn't ever be afraid to do the right thing just because the rule book is wrong. We should, in those circumstances, challenge the rule book and get the rule book actually to be right. So I think that's an element where a VADA-like organisation can help, is thinking about how we get that nimbleness, both in terms of speed, but also in terms of real diverse thinking to reach good solutions.
And if I just may add, I guess this is then also valid that when you think about the whole translational value chain, right? It starts from the beginning, from basic research translation up to the clinical and the final stage where you end up with a project, I think there. And I also like the idea that somehow these great instruments which are available, they have to be linked to each other, right? It's not enough having one great element, but then there's no transition to the next element which is required along this translational chain in order to really bring at the end a product to the patient, right, or a therapy to the patient.
Absolutely. I mean, COVID is classic, where some companies or some institutions or some regulators, some governments have seen the challenge as being essentially how do we develop a new treatment that can be licensed, can be marketed. Others have said there's a global public health crisis. How do we solve a global public health crisis? And as part of that, the chain about how do we develop a new therapy and how do we get it licensed, how do we get it approved and so on is a part of that. But one's looking way down the line and saying, actually what success looks like is very different from have I got my drug to market, which would be a conventional pharma-like approach. And different parts of pharma have got this and others haven't. But it's about setting your, what does success look like? Success in the context of COVID looks like, making a serious difference to a global pandemic. Success in the context of obesity and diabetes actually also looks something like making a big difference to a global pandemic. It just happens to be that that global pandemic is on a different time course and has a different set of, if you like, biological features. But you've got to look at what does big success look like and how do the different components, all the way from the first bright idea all the way through, what do they all look like and how can we accelerate that?
Thank you. So I think you also were mentioning the global perspective a little bit, and I think there was one question about the global perspective in the Slido section. Maybe you can, perhaps the technical staff can bring it up again. Yeah, so it was a question again from Bernard Grimm. What do we need to do in Europe to stay competitive versus the US and now China when it comes to financial investment in research and innovation? Because numbers show that we are losing ground when we look at the full continuum of the research and development investment, right? So is there any opinion from our panelists about this? Christina.
So I think we have commented a bit about this part of alignment and focus. That's definitely another thing that I think we need to learn in Europe is to fail fast. And that is something that we have to learn from other geographies. And we have, as Sabrina was saying, there's a lot of ways, there's a lot of inertia on many of the research initiatives that don't bring any result, and that we have to be able to assess and stop them earlier, because if we don't have enough resources, we have to be really clear and focused. And in terms of the alignment, I also wanted to put an example. So, for example, as Sabrina was mentioning, in the alignment of the next Horizon Europe program. So what we are seeing in the pillar 3 of innovation is that the EIT and EIC, so the Council, Innovation Council, we are trying also to coordinate the activities so that any innovation that is coming from the EIT in the end can be accelerated also by the EIC, and also the investment programs that we have at the EIT and the capacity of internationalization that we have from our network that can also be brought up to the EIC. So I think this change of mentality that COVID has brought, and I like what you have mentioned, Martin, in terms of other pandemics that we have, like diabetes, of any chronic disease, it can be tackled the same way, but could be what has brought is all at the same time, and you just cannot hide of reality, and that is the reason that has switched on really the international collaboration in a different mindset than before. Because in the past we have thought, oh, diabetes I can manage in my hospital, or this heart condition I can probably manage with my own local policy. But as you are mentioning, if we really address them internationally and say this is a global challenge, we all leverage the knowledge. We can really foster knowledge and innovation much faster, as we have seen with COVID. So I would definitely take the learnings not only in the concrete examples of vaccines or treatment, but in the process of how the culture has changed for the collaboration.
Yeah, I mean, I'd follow up on that, and I'd say that I switched from what I was doing on cardiovascular disease, which, if you like, is one of those chronic pandemics, to COVID for two reasons. One is it was quite clearly the public health issue of our day, and if we didn't get good clinical trials up and running fast, then patients were going to be harmed by our complete lack of knowledge about which treatments worked and which treatments didn't. The second was recognizing the opportunity for disruptive innovation. Now, there's a lot of people claim to do disruptive innovation. Half of Silicon Valley claims to do disruptive innovation. But I tell you, there's nothing quite as disruptive as the little COVID virus. And it struck me that actually now is the time when one could actually innovate and change mindset and change many of our sort of conventional ways of thinking, which we have just got stuck in over many, many years. Now, the challenge for us going forwards is not to go backwards. We have to say, what is it that's so different about our approach to data sharing, to clinical trials, to bringing research to the bedside? What is it that we have that we can actually learn from and enhance and build upon going forwards? You know, drug-resistant infection, antibiotic resistance, a pandemic that burns, mental health, cardiovascular disease, and chronic disease. But to return to your question, which is what about, or the questioner's question, which is what about funding? I'd argue strongly, it's not just about how much money you have, it's about how smartly you use it. And if you look across COVID over the last 6 months, and you look in the US as an example, then there's no shortage of money, but there is nothing like the impact that has been seen across Europe and elsewhere around the world, whether that's in the vaccine space, or the treatment space, which are the two areas I know well. So a lot of that comes down to having the right mindset, creating the right infrastructure. You have to do it in something of a hurry, you know, on the fly, if you like, and about leadership and collaboration and partnership, and people letting go of who gets the credit and seeing the bigger vision of what is the gain. And I guess that is also part of how one views, as a European system, research and innovation. Let's be careful not to confuse who gets the credit with let's make progress. And so I think when one has a very metric-driven system, actually what can happen is that people then focus on the metrics, not focus on the successes. And that, I think, is another place where we need to think quite differently as we go forward.
Can I add something here? And perhaps I saw some of the questions, so we can also. I have actually additional question I saw on the if alignment can really. Here, how can will alignment alone really make Europe more competitive? And I was thinking, brainstorming by myself while listening to the colleagues here. Indeed, perhaps I can add to this point. I think that yes, I mean alignment of research investment, but also research innovation investment, but also of priorities. Of the agenda, really. I mean, it's not only about money, indeed. It's about how to smart use these investments. And I want to join Martin and Andre in this important point. Indeed, when I add another point, actually very important, I think we should actually say today, it's about to align the investment, but it's also to strengthen the investment on research, innovation, and health at European level. And I'm saying that in the days quite delicate in which there is a big discussion on the future multi-annual financial framework and the use of the recovery fund. And it doesn't seem always so clear that without research and innovation, without further cooperation at European level among the countries, among the different stakeholders at European level, and exchange of good practices, so a further investment on the future research innovation program, the future health program, we cannot necessarily achieve. I mean, we cannot do that alone. We cannot work alone at national level. To do that, we need to work together. So we need also to further invest on that. So use better the resources, but also strengthen our investment at European level. And then, again, joining what was said before, yes, we have different challenges in different health research sector, but we can really make important improvement by sharing methods, sharing tools, capacity, and really build a strong network at European level.
Okay, so thank you. So I think we have time for one more question. Time is flying. It's really amazing. It's a good sign. Perhaps maybe just a reminder again to the audience, please also respond to our Slido questions so that we can close the session actually with the most important instruments what you are thinking would be important for the implementation. And the final question was one question I think about, can you maybe just go one slide back, please? It was about the collaboration between academia and industry, also with respect to IP and intellectual property, because there's a different kind of culture. And perhaps this is also something what you, Christina, mentioned before, that it would be good if also SMEs cooperate, right? But again, I think it's the same issue. How can this be handled with respect to IP issues and others? So how can one improve interaction between academia and industry?
I think it's every time you mix two worlds, you have to find first a common language and then a common culture to work together. And one of the things is probably just interaction helps, but you can definitely foster interactions with a common goal. And what we have seen in the experience of joint partnerships, collaborations, and so on is that there's one moment that people make a click and then the collaboration exists. And we have seen that also with COVID. No, there were a lot of difficulties in, for example, accepting telemedicine in many cultures, and then suddenly you don't have any other option, and now technology is acceptable and telemedicine is much more spread than 6 months before. No? So in terms of IP and regulation and the protection of the ownership of the ideas, I think there are enough tools and enough ways of sharing that knowledge and making contracts about it. It's a matter of trusting the other, and building trust is not an easy thing to do. And there are, there are instruments of change management and so on. But I think in the end, you trust what you know, and ignorance doesn't help for trust, and also diversity is a challenge for trust. And I think that is a bit also the challenge that Europe has, at the diversity part of it, that we have different cultures and different health systems, makes it a bit more complex. But once you have passed this barrier, as I say, and you know the other, the diversity is definitely an add-on, because what we are saying, in other cultures that you're competing, they don't have this, and that makes Europe as a unique test bed of any solution that we want to do in the medical world. So you have to be very clear that if something succeeds in Europe, it's going to be probably a success everywhere else, because you have an incredible test bed and lab test, no? So the key is this part of building trust, and there's not a unique magic solution for doing that. But definitely as I say, getting to know each other, understand showing examples that people are not whenever we talk about the regulatory part, the first reaction is very conservative. It's very of being afraid and so on, as in the terms of protection, in terms of not very cautious, and we have to change that barrier via, as I say, providing examples, via getting more interaction, via knowing the other, via guiding people in this process when there's not enough experience or knowledge. No?
Okay, thank you. So we are really running already, it's 5:26, so perhaps you can show again, I think, some of the words from the Slido. I think it shows already a kind of a nice summary, because it's also about collaboration. I think collaboration also includes trust. I think this is something, and it's collaboration not only among scientists and clinicians, but also among regulators, administration, about health providers, as was mentioned in the beginning. It's about innovation, so this is an important part. And also about BARDA, and I think that the mentioning of the word BARDA actually is also a reflection that this should be a possibility or seen as an instrument which can really provide also a framework for long-term interaction, collaboration, a link between the different funding instruments, and that perhaps one should not miss an opportunity when one tries to implement now this concept, so to really include also a long-term perspective and also focus on non-communicable, on chronic diseases. I think this is something which is probably an opportunity, and one should really take or ensure that we meet this opportunity and can make something out of it. And it's about, yes, regulatory clarity, concrete solutions, united acceleration. So with this, I would really like to thank all our panel speakers. I really enjoyed the session and the discussion a lot. I think it was really very interesting to hear your views from coming from different sides. But at the end, what was also very comforting is even bringing this different perspective at the end. I think it's something we are sitting together and actually want to go in the same direction. This is very comforting. I think this is very good. And with this, I would like to thank you. Also thank the participants for staying until the end of the session with us. And I would like to remind you that actually you can go back to the plenary session, which starts in 2 minutes. And so to have a kind of a wrap up also of the other breakout sessions, I will try to summarize our discussion in 3 minutes. So what we have discussed here, and with this, thanks again. I enjoyed a lot this session, and hopefully to see you at the next EU Health Summit in person. That would be fantastic. Okay, thank you very much. Bye-bye.